Hello, my name is Elizabeth Booth, and this is Drew Biegner, and we are from the University of Akron. Our advisor for this project was Dr. Ronald Otterstetter, and the title is The Accuracy of Recreational Athletes in Self-Detecting Ventilatory Threshold.
So for the significance, there's been a variety of studies conducted and completed all about the positive effects of training at or above one's lactic threshold. It also is known that there's a relationship between the lactic threshold and the ventilatory threshold, or the VT. So because of this relationship, VT could actually be used as a training parameter. Past research has shown that in endurance and elite athletes, that they can perceive the changes in their breathing associated with their own VT. There's a high level of importance associated with this VT level, as training at or above it creates a positive training adaptation. While like most things in the field of exercise science, there's been an abundance of research conducted in this field looking into elite level, professional, and NCAA level athletes. However, there has been a very little amount done into the recreational athlete, educating any and all athletes on how to use their VT to guide them during a workout should and will help them to exercise at or above the correct intensity.
So our research question is, are recreational athletes able to accurately perceive the respiratory changes associated with the ventilatory threshold during a VO2 max test, and how well does the perception of VT correlate to measured VT? So our main purpose for this study is education. As we know, to improve a recreational athlete's cardiorespiratory fitness, their intensity of training must reach a certain optimal level. It is vital for these athletes to work both the aerobic and anaerobic systems during training. In order to receive these optimal results, the athlete's training must take place above their ventilatory threshold, in which we measure using a VO2 max test. We have an understanding that the VT is associated with the anaerobic threshold, and thus is an important marker of when an individual crosses into their anaerobic system. Therefore, an athlete's ability to knowingly perceive this threshold is of the utmost importance when it comes to training. If an athlete cannot recognize the common signs and signals of reaching this threshold, then they will be risking training at an intensity that is not going to reap them the benefits they seek.
So for our methodology, all of the recruited students will be recreational athletes at the University of Akron between the ages of 18 and 35 who do not compete at the NCAA level and work out regularly at least 3 times a week for at least 30 minutes. This recruitment will take place through flyers hung around campus and also social media posts. Our desired sample size is at least 25 subjects with a wide variety of recreational athletic habits. All testing will also take place at the University of Akron in our human performance labs. Subjects will be asked to refrain from a few things such as alcohol, caffeine, and strenuous activity before the test. On the test day, subjects will be informed of all procedures, then asked to fill out an informed consent form, as well as a brief activity form. Then, all resting measurements will be taken and a body composition test will be assessed. Subjects will then be read a script with the description and concept of the VT, and then will be taught when they should try to raise their hand during our testing to identify their own VT. Subjects will then warm up and begin their VO2 test using a modified treadmill protocol that begins at 5 miles per hour and 0% grade, then increases speed each minute by 0.5 miles per hour. Once a subject hits 9.5 miles per hour, the grade will then begin to increase by 2% each minute while the speed stays at 9.5 miles per hour. The subject will stop when they meet the ACSM VO2 max parameters, or if they request to stop early, and then will begin their cool down. The statistics for this test will be a t-test for the time of actual VT versus self-determined VT, and a t-test for VO2 of the actual VT versus the self-determined VT, with a significance for both of those set at a p-value less than or equal to 0.05.
We do expect that those recreational athletes who have had a history of endurance activities and training will be able to accurately perceive their self-detected VT in comparison to their measured VT. This is in part due to these athletes who have more than likely been trained to perceive these changes. We will also be looking at a comparison of body composition to ability to perceive through bod pod results and the results of the VO2 max test. We expect that those who have a lower percentage of body fat will be more likely to perceive these changes in VT.
So here's our references for this slideshow. And here are our 2 questions for this slideshow.